Welcome, and thank you for joining me. Today we'll be discussing non-alcoholic fatty liver disease. The American Liver Foundation defines non-alcoholic fatty liver disease as the buildup of extra fat in liver cells that is not caused by alcohol. They go on to say it is normal for the liver to contain some fat. However, if more than 5% to 10% of the liver's weight is fat, then it's called fatty liver, also known as steatosis. Non-alcoholic fatty liver disease is the most common etiology of chronic liver disease in the developed world. Experts believe it affects between 9% and 37% of the world's population, and 30% of the United States population. It affects 58% of people who are overweight and 90% of people who are morbidly obese. Primary non-alcoholic fatty liver disease has been linked with metabolic syndrome, which is a group of 5 risk factors that increase your chance of developing heart disease, diabetes, or suffering from a stroke. These risk factors are a larger waistline, a high triglyceride level, a low HDL cholesterol level, high blood pressure, and finally, a high fasting blood sugar. Secondary non-alcoholic fatty liver disease is associated with hepatitis C, HIV, and other hepatic affecting diseases. All of these conditions that can put an extra strain on your liver functioning and can lead to end-stage liver failure if left untreated. Fatty liver disease was once thought to be harmless. However, new studies have shown a direct correlation between non-alcoholic fatty liver disease and an increase in liver-related morbidity. This is primarily because fatty liver is an indicator of other deadly diseases, including non-alcoholic steatohepatitis, which affects a large percentage of patients that suffer from non-alcoholic fatty liver disease. So, what does it look like, and how can you determine if you're suffering from non-alcoholic fatty liver disease? As you can see here, a fatty liver is going to be slightly enlarged and discolored when compared to a normal liver, which weighs roughly 3 pounds and is the largest solid organ in the human body. It may also have scarring, and depending on the stage of fatty liver disease, it may show signs of cirrhosis, as you can see on the liver to the right. Now, since the liver is not visible externally, it may not be obvious that a patient is suffering from non-alcoholic fatty liver disease. Fatty liver disease is normally diagnosed following an abnormal liver function panel conducted by your doctor. The doctor will then order an ultrasound or CT scan of the liver to confirm that it is enlarged. Then they may even order a liver biopsy to determine the severity and stage of the non-alcoholic fatty liver disease. So you may be wondering, why does it matter if my liver is enlarged 5 to 10%? That doesn't really sound that bad. Well, non-alcoholic fatty liver disease is largely asymptomatic, with the only common symptoms being fatigue and pain in the right upper quadrant of the abdomen. The problem that you run into is that it's also one of the leading causes of cirrhosis of the liver. Cirrhosis of the liver is a scarring caused by the liver attempting to repair itself. Each time it repairs itself, it leaves scar tissue, and over time this scar tissue begins to impede the liver's ability to cleanse your blood supply, convert nutrients in our food into materials the body can use, break down damaged blood cells and to allow the proper clotting of blood, metabolize fats into energy, metabolize sugars into glycogen, and once the damage to the liver is done, it's typically irreversible, and patients become at a greater risk of heart failure, colorectal cancer, type 2 diabetes mellitus, thyroid issues, as well as osteoporosis. So, now that we know what the complications are with non-alcoholic fatty liver disease, who's the most at risk? As I stated earlier, 58% of overweight people and 90% of morbidly obese people suffer from non-alcoholic fatty liver disease. 75% of obese people in the Western world develop non-alcoholic fatty liver disease. So it's pretty obvious to say the more that you weigh, the more likely chances are of developing the disease. It's most common in both males and females when they are between the ages of 40 to 49 years old, especially if they're overweight. And when we look at ethnicity breakdown, 45% of Hispanics, 33% of Caucasians, and 24% of African Americans have non-alcoholic fatty liver disease. Japanese studies have shown roughly 14% of the population affected, And if you look at northern Italy, it's believed that it's about 20% of the population that's developed the disease. So the big difference between the racial groups and ethnicities is believed to be largely due to the different diets and the lower rates of obesities in the Japanese cultures and also third world countries with less access to fatty foods. Despite weight being the most common cause of non-alcoholic fatty liver disease, roughly 7% of the people who have a normal BMI also suffer from the disease. As you can see on the slide, 49% of patients that have type 2 diabetes mellitus also have non-alcoholic fatty liver disease, and we've already established that it's a complicating factor. When it comes to non-alcoholic steatohepatitis, women are 2 times more likely as men to progress to the stage. And then, just so that we're clear, to qualify as non-alcoholic fatty liver disease, as opposed to alcohol-related fatty liver disease, you must consume 2 or fewer drinks every day. So, what can we do to prevent or treat non-alcoholic fatty liver disease? If you're looking for a pill, as of right now, you're out of luck. While there are some drugs being researched for the treatment of the disease, as of now, none have received FDA approval. The first recommendation that we have is to get vaccinated, if you have not already, against both hepatitis A and B to prevent other significant causes of liver damage. Once you've done that, the preferred treatment method of the disease is weight loss. Plain and simple, you must diet and exercise. It's not enough to just lose the weight using a surgery or diet pills. You must fundamentally change your lifestyle to be healthier. If the patient can lose between 5 to 10% of their overall body fat, it is possible to reverse some of the effects of non-alcoholic fatty liver disease. If the disease is caught early enough, it is possible to manage it and prevent it from ever developing into non-alcoholic steatohepatitis, cirrhosis, or end-stage liver failure. However, once it has progressed into cirrhosis, the effects are irreversible. And if you've reached end-stage liver failure, your only hope is going to be a liver transplant. I would like to thank everyone for watching today. While I recognize that non-alcoholic fatty liver disease is not the flashiest of diseases, it is a real problem, currently affecting almost 1/3 of our population globally and about 64 million individuals in the United States. The medical costs associated with the disease are over $103 billion annually in the United States alone. And that's not considering the other burdensome effects of obesity and the diseases that can stem from non-alcoholic fatty liver disease. Thank you.